I am Dr. Deepa Dewan. I am a Senior Director at Cloudnine Hospital, Golf Course Road, Gurugram. So you've been suffering from abnormal uterine bleeding? It could be of any form. It could be a bleeding which is heavy, a heavy menstrual bleed. It could be a lighter menstrual bleed. It could also be an irregular bleeding. There could be intermenstrual bleeding. So if your problem is a heavy menstrual bleed, what are your causes of that and what could be your treatment options? So a lot of things depend on what your age is. So if you're a middle-aged lady and you've been having heavy menstrual bleeding, you must need some investigations to diagnose the heavy menstrual bleeding. The first, of course, can be if this is one odd episode, check for a pregnancy or a pregnancy loss. That's the first thing we need to check for somebody who's having abnormal uterine bleeding and is in the reproductive age group. The second thing that we need to check, is there a lesion? Is there an abnormality in the uterus in the form of a thickened lining of the uterus? Could there be a polyp inside the uterus? So these things need to be checked. Could there be a problem at the cervix, that is the mouth of the uterus? So a growth on the mouth of the uterus could also lead to abnormal uterine bleeding. We also need to check the ovaries. A cyst in the ovary can also lead to such problems. There could be a hormonal issue. So your hormones, your thyroid hormone, LH-FSH hormones need to be checked. If you have an abnormality on the hormones, they need to be corrected. So if you have abnormal uterine bleeding, looking at these causes, your healthcare provider will get to do a few tests for you, which would include, of course, your hormonal tests, including the thyroid. It would also include your complete blood counts, because we want to know, because of the heavy menstrual bleed, how much heavy bleeding has happened and how much blood you've lost. Then we like to get to the cause. So let's say if your thyroid was normal, we would want an ultrasound to be done. What are we looking at in the ultrasound? We want to check for the lining, the thickness of the lining of the uterus. We also want to check if there's any cyst. We want to check if there's a polyp inside the uterus, any lesions which we can pick up on the cervix. The doctor would want to do a papsmear for you so that she can pick up anything abnormal on the cervix. An internal examination and a papsmear is also important. So once we have done these tests, we would come to a conclusion why the bleeding is happening. If we find an organic cause, we will of course treat it. We will treat, if there's a polyp, we would like to do a hysteroscopy, remove the polyp. It's a daycare procedure, easily done. You don't need a cut for that, and the polyp can be removed and sent for testing. If it's a thick lining of the uterus, that can also be removed and sent for testing to see if there's a hyperplasia. If there is a cyst, if it looks like a physiological cyst, we can wait for some time, repeat the ultrasound. If it looks like a pathological cyst, it can be removed and sent for testing. If it was a thyroid issue or a hormonal issue, can be addressed and medical treatment can be given. But if we could not find an organic cause, then where do we stand? There are options of conservative and surgical management of such cases. So the first conservative treatment that I would like to speak about is the medical treatment, wherein for the heavy menstrual bleeding, you can just take some tablets like tranexamic acid tablets and the bleeding can be controlled. But if you want to really get to the diagnosis, we would like to do a hysteroscopy for you. What is a hysteroscopy? Hysteroscopy is an instrument, it's a telescope which is put inside the uterus through the vagina and the cervix without creating a cut, and the inside of the uterus is visualized. On the inside of the uterus, we check the inside and see if there's any polyp, any growth, any thickened endometrium, and that can be removed and sent for testing. Once that is done and the histopath report comes, we can get to a diagnosis of why the heavy menstrual bleeding was happening. At the same sitting, we can offer the patient insertion of intrauterine device which is loaded with a hormone. It secretes a small amount of progesterone hormone into the uterus, and with the help of this, the heavy menstrual bleeding can be controlled. 70% of women would reduce their bleeding to almost spotting within the next 3 months insertion. The other option could be oral medications of progesterone, which can be given once the diagnosis has been established and we have checked the inside of the uterus. So these are some conservative managements. There is also the option of ablating the inner lining of the uterus, which is called endometrial ablation or thermal therapy, which can be done, in which we burn out the lining of the uterus or remove it completely so that the bleeding reduces. The last resort, I would say, would be a hysterectomy. So if there's so many conservative treatments available and we've done a diagnosis and we've not found a reason which can be threatening to you, then hysterectomy should always be a last option. That of course is an option. One can also get a hysterectomy done, so it depends on your age. So if you're in a perimenopause or you're menopausal, and you're not getting relief from the other methods, then of course hysterectomy is an option for abnormal uterine bleeding as well.